Welcome to Ultrasound Shorts with Dr. Shokwe. This is a concise educational resource aimed at delivering to you essential concepts and skills in ultrasonography that are tailored to support informed decision making and effective patient care. In this video, we will be continuing our series on ultrasound terminologies. We will be discussing echogenicity. Previously, we mentioned that the ultrasound image is a visual representation or interpretation of all reflected waves received by the transducer. To put this in context, ultrasound waves generated from piezoelectric crystals within the ultrasound transducer are propagated towards the object. These waves sent out by the transducer or probe are the incident waves. Out of these incident waves, some of these ultrasound waves will encounter the object or tissue along its path and bounce off that structure and will now be propagated towards the transducer. It is these reflected waves or echoes, not the incident wave, that will determine the image brightness. Although increasing the amount of incident waves may determine the amount of echoes that are generated, this is not always true, as tissue property may also influence image outcome. The most direct influence for image brightness is the amount of reflected echoes from the area of focus. And when we consider the ultrasound image's spectrum of brightness, it ranges from being black, which means that no echoes were received at all, to different shades of gray, which means some amount of echoes were received, to being white, which means a great amount of echoes returned towards the transducer from that tissue structure in particular. In other words, the black, white, and different shades of gray we appreciate on the ultrasound image is a visual representation of how much echoes return from various tissue types within the area of focus. The more the reflected waves or echoes picked by the transducer from a structure, the brighter the structure will appear. What makes a tissue return more or less echoes is determined by an acoustic property of tissue called the acoustic impedance. It is a measure of how much a tissue or structure will resist the ultrasound waves from passing through its entire thickness. The acoustic impedance objectively measures how much a tissue will resist the flow of ultrasound waves as it attempts to pass through it. High acoustic impedance tissues like bones and ligaments resist sound waves very strongly, therefore reflect more waves towards the probe, and this will make the image appear brighter on the ultrasound. On the other hand, low acoustic impedance tissues will offer very little resistance to the sound waves. This would allow more sound waves to penetrate through the entire thickness of the tissue and very little to be reflected back towards the transducer. The images will therefore appear darker as fewer waves are reflected as echoes. This acoustic impedance is a complex property of tissue that is determined by the interaction of three tissue properties, which are the density, the viscosity, and the elasticity. To comprehend how these tissue properties will determine acoustic impedance or image brightness, one must picture how these variables individually affect sound transmission. Dense structures which have very little intermolecular spaces will not favor penetration of sound waves through its entire thickness, as very little sound waves will escape through the pores to the other end of the tissue depth. Therefore, more sound waves will bounce off the molecules and be reflected or propagated away from the tissue surface as echoes directed towards the transducer. On the other hand, less dense tissues will have large intermolecular spaces that allow for easy transmission or penetration through the tissue depth. Secondly, an elastic or stiff structure has the ability to resist deformation. It will push back sound waves in another direction due to its elastic nature. A better way to imagine this is to picture the knock and the fletcher of an arrow as it is applied on the string of a bow. The elastic string will push the arrow back in the opposite direction that the initial force was applied. To understand the last one, which is viscosity, we can picture a rodent that it needs to run across a straight line AB to pick a piece of cheese at point B and return back to point A where it initially started from. Then we can now picture it running through, and halfway in the journey, it encounters a strong adhesive. This adhesive traps this rodent along the way before it gets to point B. It cannot move to point B, neither can it return back to point A. The same way, a very viscous material will trap or absorb sound waves, converting it into its energy, not allowing for its transmission through the object and not allowing for its reflection back from the object surface or the object layer which it bounced off. In summary, high density structures reduce sound waves penetration by their very little intermolecular space. This will increase reflection or bounced back echoes, which the transducer will receive, and a bright image will be formed. While low density structures will increase sound wave penetration, the amount of reflected waves will reduce, and this amount of reflected waves will be picked by the transducer, but a darker image will be formed. A highly elastic tissue will bounce back sound waves more readily, leading to more reflected echoes for image generation and interpretation. While tissues with low elasticity will easily allow passage of sound waves, leading to reduced echogenicity. And finally, high viscosity will increase sound wave attenuation by absorbing and trapping incoming sound waves, converting it into its energy. This will reduce returning echoes and cause darker images. Low viscosity will also favor the formation of images with reduced echogenicity by allowing for more penetration. High density tissues that are very compact and stiff, therefore, like bones and cartilage, will reflect, as we can see from this diagram, most of the propagated sound waves It will allow for minimal penetration through the object, and thus the object will appear bright. Moderately dense structures, which have low elasticity and demonstrate some viscosity, would allow for greater transmission or penetration through the object. A lesser amount of reflected waves will therefore return to the transducer for image processing. The images would therefore appear gray. The shade of gray which we would see would actually depend on the number of echoes received by the transducer within that area of focus. Lastly, low density materials with low or high viscosity, e.g., fluid or mucinous material, have most of the sound waves penetrating the entire depth, and this would result in dark images as reflected echoes or reflected waves are reduced. The high viscosity would also allow for more attenuation than reflection, as it absorbs most of the sound waves, can convert them into heat energy. Little to no echoes will usually be picked within fluid pockets. This makes the image appear black. To summarize, how well the interrogated tissue will reflect or allow for transmission of sound waves is what confers the property of echogenicity. Echogenicity can therefore be defined as the ability of a tissue to reflect or transmit ultrasound waves. Note that it is usually described in context with other tissues. Stay tuned to learn the four main appearances of tissue echoes within the echogenicity spectrum in the next video.